Shanae, you want everybody logging in the chat for attendance?
Yes, please.
So please do put your name and organization in the chat if you haven't already. And just as a reminder, it helps us a lot if you keep yourself muted unless you are contributing to the conversation, or if we call for an audible vote instead of posting a poll. Good morning and thank you for being here. This is the monthly CoC membership meeting, and I am Beth Waddle, your CoC chair, and we really appreciate you taking the time to be with us this morning. We are called to order and we have started recording. Our first order of business is to approve the May minutes, and it looks like Shanae is pulling those up for us. Any questions or concerns about the May minutes? Hey, I have a voice this month. Thank you, by the way, Shanae, for taking the task and leading the May meeting. It was not a pretty sound to hear me talk. Thankfully, I didn't feel quite as awful as I sounded, but every time somebody heard me, they moved 10 feet away from me because I sounded like I was about to die and they didn't want to catch death. Any questions about the May meetings? Hearing none, we would entertain a motion to approve those minutes.
Move to approve.
Carolyn, I'll second that.
Thank you, Carolyn. And do we have a poll, Shanae, or are we calling an audible?
Just call it out.
Perfect. We're very comfortable with audibles when we are dealing with things that we don't expect any concerns or nays on. So all in favor of approving the May minutes, say aye.
Aye.
Hi.
Hi.
Any opposed, same sign. Motion carries. And we will move on to CoC lead agency updates, starting with Christy.
Sorry. Good morning, everyone. Christine McBurby. So we have some seven data to report to you guys. Sarah Kinder was hired as a Douglas County Regional Coordinator. Since when it started on the 26th. Sarah's from Lawrence, and really excited about getting more involved with the Douglas County region. So that's a new hire. She was with us previously with them coordinating the entry tree. So be a new hire, but a new this job. Also our archivist and Ty Martin resigned. I had what they was laid off in March. To that call back from the Trump administration, and she got a new job, and she was working for us part-time, but our new job has more demanding than would be, so she resigned. So she was doing coordinated country assessments for us. Also Eric Kirkbright resigned as well. He's here. I don't know if he wants to talk about music as a future videos or not.
No, just this was a difficult decision for me, but you know, it's needed a break. So I love the balance. This has been my life for better part of a decade. I love you all. You guys have been my life for better part of a decade. Christy, you have been so wonderful. Alicia Flint is amazing. I just can't thank you all enough for letting me be here. I hope that the fact that we were able to in FY22 and FY23 we were able to bring our NOFO scores to where they are and where they were this past year. Probably this past one kind of broke me a little bit, to be honest with you. But the fact is that when FY20 and FY21 we're higher scoring than we've ever been. And so knowing that I was a big part of that is very important to me and things like that. So but the balance means everything to me, and I'm so glad to be a part that I've been a part of it. So thank you all so much for allowing me to be a part of it and a part of your lives and the things that you do. I appreciate it so much.
Well, Monsieur, Eric was here when I first started this job, 21, he really helped me. And
We
Sarah,
can't hear you, Christy.
Just me, but we can't hear you, Christy.
so,
You got like really quiet.
Is this better? No. Listen to this essay. Mother? No. Can you hear me?
You're barely a whisper.
Yeah. Okay. Today I'm going to start.
I think you asked me to continue. Is that okay? Okay, so we did want to state that Alicia Flint, who was one of our regional coordinators, have moved to a new position that we have. As you guys all know, we've been doing a little bit of can rent, which Kayla will talk a little bit about in detail later. And that responsibility was spread out between all the regional coordinators, and with everything they're doing, that was a lot. So what we were able to do is create a dedicated position that would work with landlords and bringing them on and trying to get more use of that system so that we can more easily connect individuals who are experiencing homelessness to units that have agreed to take on vouchers. So Alicia, is there anything you'd like to say about any excitement that you have for the position you're moving into?
Sure, thank you, Shanae. I wouldn't say that it's a bad switch or it's a good switch. It's just kind of the circumstances of what we're all going through right now with all the changes. And then one of my changes is I'm starting my internship in August for soma therapy in Wichita. So I'll be beginning my clinical journey, and so I need to step back a little bit from KSHC and work part-time because I'll be working 16 hours a week over there. So I'm really excited to be doing CanRant because I'll still be involved in the regional coordination aspect somewhat, and I'll still be able to help in any agencies that need any direction. So thank you.
See, do you want to check your sound now? See how you?
Gary?
No.
The only thing I would know, Christy, would be to recommend rebooting your computer and seeing if that resets your microphone.
All right. With that, with Eric leaving us, I will be moving forward, assuming most of his responsibilities in my current position. And we did that because then that would give us an opportunity to create a more dedicated regional coordination position as well. So I'll be assuming Eric's responsibilities, and then that has given us the ability to have another regional coordinator. So we will be hiring for 2 regional coordinators, Eastern and Central regions. So we're pretty excited. Kayla is manning that as the Director of Regional Coordination. And then, as you guys know, we had previously lost our KDADS grants. However, they've been working with us really closely, trying to give us something else, bring back a lot of the services that we weren't able to do because of the cancellation of that grant. So it has been successful. And so a part of this new grant that we've gotten from KDADS will be bringing on housing crisis counselors. So one will be dedicated to the Balance Estate, one will be dedicated to Wyandotte CoC, and one will be dedicated to Johnson County CoC. So I know that some of those positions are out of our current CoC, but KDADS really wants us to assist with statewide coordination. So a part of that, which will help us as the Balance Estate, is as you guys know, sometimes we have clients transfer between CoCs and need to, like if they're in a skilled nursing home over here, they might need to go over here with their family. And so there's a lot of that crossing in the CoC. So we're hoping that some of these housing crisis counselors will help us with our cross CoC coordination. I see you're back, Christy. You want to try again?
Gary? No.
Okay. Okay, well then I'll just keep going. Feel free, Christy, write anything in the chat if I'm missing anything. Okay, so as you guys know, a few months ago, we started a internal transition based on feedback from our agencies, from CoC members and internal feedback. We started trying to attempt different transitions. So we are still in the middle of doing that. But we wanted to tell you guys what this new transition is gonna look like moving forward. So based on that feedback, we will be moving coordinated entry front end, which we like to call case conferencing and referrals, will be completed by the regional coordinators moving forward. This was initially how it was done when I first joined the CoC, and Beth, correct me if I'm wrong, the regional coordinators did all the they were volunteer at the time, but they did all the CES referrals, they did all of that. However, that was too much work for volunteer. But now with Christy's work, we've been able to have paid regional coordinators at Kansas Statewide Homeless Coalition. So now we thought it'd be a perfect time to move those activities back to the regional coordinators. They're already in those meetings, they're already participating, they're already doing a good amount of case coordination with the agencies. So we were like, it makes sense. And so moving forward, we don't have an official launch date. We still need to get those 2 new regional coordinators hired and trained and all that. But moving forward, we're hoping that by just having one person that you guys could reach out to, helping with CES, case conferencing and referrals, and then the second item on there is CoC, HMIS, and CES onboarding will be done by the regional coordinators. So this is going to mean that the agencies are going to have one point of contact for all of this front end work, which we heard based on feedback, like the process of getting into HMIS and coordinated entry, we would send you to the HMIS team, and then we'd send you to the coordinated entry team, and then we'd have to inform the regional coordinators that you're involved, add you to the regional plan, so there was just so many people involved. So we're hoping that this allows it to streamline and makes the process a little bit easier for all of you guys. So we'll also be training on that onboarding process and giving more details about that as we hash that out. But we were pretty excited to announce that change so that we can make it easier for everybody to come on board, stay on board, and work on those referrals and case conferencing meetings all together with your one point in contact.
I have a quick question, if I could. Yeah. So for the new hires and the people that need to go through to get HMI access, is there because like currently I think we submit a ticket. What is the process for that? We have a new hire, Abby, who is actually on the call this morning, and I don't know when that takes effect or like what we need to do to get her started.
Yeah, Kayla, do you want to talk a little bit about that?
Yeah, right now you'll still submit a ticket. We are still working on that process and workflow, so submitting a ticket is the best way.
For now.
Hi, this is Cookie. I have a question as well. So currently, if we need referrals, are we still submitting a ticket? Correct?
Yes.
Yes,
Okay.
so the front end referrals we're talking about is the referrals that happen during case conferencing, right? If you need a referral outside of the case conferencing meetings, then yes, you would submit a ticket.
Thank you.
But moving forward, the regional coordinators, they'll be able to do the meeting and then immediately send the referrals right after the meeting. So we're hoping that that also helps with our timeliness as well to get those referrals to everybody.
Okay, that makes a little bit more sense in the way you just explained it, Shanae. I appreciate it.
Of course. And then like Kayla said, so as soon as we get that workflow done, we'll send out those documents that'll kind of show like, here, this is what you do, the process. So we're hoping that that will also help guide everybody through the changes that we're making. Yes, and Christy, our plan is our to-go date is in July. So as of right now, just keep doing what we're doing, but know that there's exciting changes happening. All right. So next thing, as we've been saying, this is a reminder, we will be transitioning from our CoC membership listserv. As of today, it will be retired. So if you have not filled out a new CoC membership application, then you are not going to be on the listserv. So if you got this email today, it was for this meeting, it was a combination of the old listserv and the new one. So make sure that you have filled out the application within the last, if you haven't done it in the last 3 months, then you need to do it again. Not again, like if you did it last year. So what that looks like is here, just for reference. So it should say 2025 membership form. And that will put you automatically on the new listserv, so you won't have to worry about staying on. You'll have to make sure that you apply. Make sure anybody in your organization that wants to be updated on CoC items also fill out a membership form, because we've connected the membership form to our listserv to ensure that they have a membership form and to be on our listserv. If you're not 100% sure, as I told you guys previously, at the end of every agenda will be the updated membership attendance. So up here are organizations that have applied for voting rights. So here's all the list of the organizations. Then here are the organizations that have general memberships. If you're supposed to be up here, but you're down here, that means that you haven't had a representative fill it out yet and say, yes, I'm a voting member. So if you need to be a voting member, please have your voting person that you would like fill out that membership, and you choose, just for clarity, so you choose organizational representative. So you're a voting member, then it'll ask if you're primary or secondary. And then if you're primary, it'll ask you for your secondary voting person. So that's how you'll fill that out if you want voting rights in this meeting. And then at the bottom is individual members, but I didn't put their names there, just that count. All right, so if you haven't done that, please do that. Like I said, we'll be retiring the listserv as of today. And so the next thing, so after tomorrow, we plan on reaching out to all of the CoC members to see if they would like to be featured on our website, like with their logo a description of their agency, all of that stuff, so that everybody can be informed about everybody who participates in the CoC membership. So that'll be coming out soon, and it's voluntary, of course, but we just want to be able to share all of the work that you guys are doing and all of the agencies that are contributing to this work. And that's all I have, unless there's questions.
Hey, this is Cookie. I'm sorry, I'm having a Monday moment here. Where can we get the agenda?
Yeah, it should have went out this morning if you were on the listserv.
All right, let me check.
If not, here is the membership application. If you fill that out, then you'll be added to the listserv automatically.
No, I'm not talking about the list. I'm talking about the agenda for this meeting.
It should have went out this morning.
It was a link on the, but many links on one email.
Yes.
Cookie.
Okay, thank you. I missed that. I told you it's my Monday.
Any other questions for Shanae? All right, thank you, Shanae. We will move on to statewide initiatives, starting with the Built for Zero update with Sarah Kinder.
I'm actually gonna give that update for Douglas County.
Thank you, Kayla.
We have some super exciting news that Douglas County has got a 29 out of 29 score on their scorecard. So don't everybody cheer at once, but that is really exciting, and it was a lot of hard work. So what this means for Douglas County is that they are going to be in the process of getting certified for their quality data. And that's what we're all working towards. And that's exciting that Douglas County has reached that. So what they'll be doing this month and in the coming weeks is just nailing down the policies and narrative, getting that into one form so that we can submit that to Community Solutions and have their data team review our data, review our processes and our plans for Douglas County's plans as far as collaboration, outreach, and inreach. So this is a big milestone, and we're excited for our other regions to make progress in this, which they're all doing really awesome. It's all about collaboration and getting in that quality data. So I think we're all moving in the right direction, but I definitely wanted to celebrate Douglas County today and this big achievement. So more news to come on that soon.
Does Jill or Kristen want to say a word or two?
I'm really excited, guys. Good job, everyone.
Great job, Kristen. Were instrumental in getting this going. So much appreciated. That's
All right.
That
Kayla,
part.
I was going to say, do you want to go on with Can Rent, Kayla?
Yeah. I think Shanae touched on it, that we're really excited that we get to keep Alicia as she goes on this new journey for her practicum, which is super exciting. And it's great that we get to keep her for this Can Rent position. What we're hoping to do with it is have milestones that need to be met monthly as far as landlord engagement, so that we can really get some momentum moving on getting landlords onto our Can Rent platform, so that case managers can use that to help house their clients. So she's been working really hard on creating that plan for landlord engagement, which we have a lot of stuff prepared already, but it'll definitely be a targeted approach once she starts July 1st. And that will be for all of our regions. And we're really excited to have her still be part of the regional coordinator team. So We're hoping to provide updates monthly during this membership meeting on our progress. Landlords contacted, landlords that have agreed to participate, and getting case managers onboarded into Can Rent and see all the features and be able to connect with landlords quickly. So that's very exciting news. Any questions on Can Rent? Okay, I'm gonna move to the next one.
Perfect.
So I'm gonna kind of read off of this a little bit. Our Kansas Housing Advocacy Network Steering Committee, we are going to vote today. We asked our listserv and in our meeting last month for nominations. What this is, each CoC is going to designate one voting member, somebody with lived experience and diverse work and life experiences with housing and homeless systems across the state. It'll be an appointed position, 2-year term. They can be reappointed for up to 3 consecutive terms, and they are a voting member. So each CoC will designate their voting member, and we have received 2 nominations. I'm not sure. David Fields with Sunflower Health Plan was one nominee. He's not here today. He had another meeting. And then we had Tammy Winteringer from Mears. I'm not sure if she is on today either. Doesn't look like it. So Tammy and David are our 2 nominations for the CAN Steering Committee representative. We're also going to have there's seats for 5 members at large and people with lived experience. So for lived experience, we're seeking somebody who rural, suburban, metropolitan, urban representation and diverse life experiences with housing and homelessness across the state. Will nominate and elected by the CoC designees and co-conveners. And we have 1 nomination for that as well, which is our Lived Experience Advisory Board co-chair, Christine English Baird. And I saw her on here, so she's here today. Christy, I'm not sure what you want to do since both of our nominees are not in the meeting today. We need to vote today. Okay. Let's see. Let me see if I can set up a poll real quick and we can vote. I will just kind of, while I'm setting up this poll, I'm just going to kind of talk about what this CAN member will do. They're going to maintain regular attendance and engagement at all of the Kansas Housing Advocacy Network meetings. They're going to develop and support our CAN policy and priorities and sign-on letters. And they're going to connect regularly and develop relationships with community and elected officials. And help us create network sharing, CAN messaging and opportunities. And this person on the steering committee will be somebody who is designated to make quick decisions when bills come up, when testimony is needed. And that's the purpose of this designated seat. But you're also still available to join, everybody's available to join the regular CAN membership. And I can put that link in the chat if you're not receiving those emails and you'd like to.
Kayla, can you
Yeah.
tell a little bit about each of them? Because I don't know either one of them. So it's really hard to even, it'd just be like, oh, just pick this one.
Right. So I did not really get a response from Tammy. But I can tell you a little bit about David. I did ask them, each of them, to send me a little bit of information about them and invite them to the meeting. David Fields is the resource manager at Sunflower Health Plan, and he's been very involved in the CoC. He's part of our performance and compliance committee. He sits on that committee. He also joins our regional planning meetings. And he has expressed interest in our lived experience advisory board meetings as well, and has helped kind of shape a lot of what we do. He's very active within our CoC. Tammy, I'm not sure if Shanae or Christy, if you guys are familiar with her, she nominated herself. Okay, and she's from yours, and I'm not even sure which location.
What was the last name? Tammy?
Winneringer.
So I know that Mears is in Lawrence.
Okay.
I haven't really known Tammy too well through Mears, but I've actually known her since I was a kid. I was actually friends with her son a long time ago in Ottawa. But actually I haven't known her too well with Mears, but I do know it is in Lawrence.
Okay. Does anybody else can speak on either David or Tammy as far as CoC involvement or homeless systems involvement? Okay. Well, I wish I could provide you guys with more information on these two, and I feel a little bad giving you guys this poll blindly. But here it goes. I'll give it just a couple more seconds. Looks like we've got about half of the meeting done with the poll. Half of the participants in the meeting. Okay. So I have, well, people are still answering. Sorry, I'm gonna give it just a couple more seconds, okay, guys? Okay. I'm gonna go ahead and end. So it looks like, can you guys see the results on there? Okay. So it looks like David was 62%. So I will notify him that we have accepted his nomination for the Kansas Housing Advocacy Network Steering Committee. Christy, do you want to vote on our person with lived experience member at large? There's only one nomination, it's Christine. So let me put that in here. Christine, do you want to jump on and maybe talk about yourself a little bit?
Sure. I'm the co-chair for the Lived Experience Advisory Board. I also serve on the board of directors. Let's see. I do a lot of, I don't know, do you want me to like talk about my experience with homelessness or like what I do in the community?
You can just talk about maybe what you're doing with the Lived Experience Advisory Board, your experience working in the homeless response system, and why you'd like to be a part of the steering committee.
Okay, so I am super involved in our Lived Experience Advisory Board. Lived experiences, I'm super passionate about lived experience, obviously. I experienced homelessness due to domestic violence. I am now involved in a lot of committee meetings, so I like to stay involved. I think I would be good at it just because I attend all the meetings anyway, or I try to. And I'm super passionate about the balance of state and the other CoCs and just ending homelessness in Kansas in general. So. Was that good?
Yes, that was wonderful.
Okay, sorry.
You
caught me off guard a little bit.
I'm so sorry.
That's okay.
You've been such a great person to work with the advisory board and you know, all the things that we've been doing within the CoC. So I've really appreciated
Thank you.
Yeah. Okay. I'm not really sure what to put on this poll since Christine is our only nomination. Shanae, any guidance?
It should be a yes, no vote.
Okay.
You could do it abstain for the third one,
That's true.
just in
That's
case.
true.
Okay. I was gonna put Batman, but I was like, I don't want anybody to have to fight Christine for Batman, so okay. All right, you should be seeing that poll. And this will also be a 2-year term and may be reappointed after 3 consecutive terms as well. Okay. Just give it a couple more seconds. All right, great participation in that one. I'll go ahead and end this poll. And of course, we have a yes vote for Christine English Beard to be our member at large for the Kansas Housing Advocacy Network. And we are so excited. Congratulations, Christine.
Thank you. I'm excited.
And that's all I have. I will get with Christine and David and give them the information on the CAN steering committee. So thank you guys.
Thank you, Kayla. All right, we will move on to our next line of business. HUD Continuum of Care updates. We will go back to Shanae for.
Thank you, Beth. So as you guys may know, a few days ago, the administration sent out a supplement, a technical supplement to their FY 2026 budget. So what the budget that is going through that is being looked at right now is called the One Big Beautiful Bill. They had provided some initial skinny budget details, but this new document goes into the actual items and the amounts of money, comparing them. So I did have that as a direct link on the agenda, but I will click on that and put that link in the chat. This is directly from the White House. Okay, so the PDF is in there. So the key that the part of this budget that there are many parts of this budget that will affect us. But specifically, if we focus in on the CoC parts that will affect us, that begins on page 471. So if you scroll to the bottom, you'll see homeless assistance grants. They go into detail here about the 2024 actual, the 2025 estimate, and the 2026 estimate. I do want to show that even though this looks like an increase, it's a key piece here that you read this part, which I do have in our budget. The homeless assistance grants account provides funds for programs that serve individuals and families who are homeless or at risk of homelessness through a variety of housing and service intervention. The budget provides $0.02 billion for an expanded emergency solutions grant program, which allocates funds directly to state and local governments through a formula that prioritizes geographical areas with the greatest need in order to assist homeless individuals or those at risk of homelessness on an emergency short and or medium term basis. The budget does not provide funding for the Continuum of Care program, the Permanent Supportive Housing program, the Youth Homelessness Demonstration Program, or the National Homeless Data Analysis Project. So it does look like this proposal is to move all those funding into the ESG state program, which would effectively eliminate CoC programs, this CoC planning body, all the work we do as a CoC, trying to bring it together and put it completely under the state. And while we don't know exactly what that would look like, the consequences of that, it does not bode well for the CoC as a whole, and the work that we're doing and the funding that we get. So we are, our responsibility as the CoC lead is to inform, and that is what we are doing right now. And so I did want to provide a statement from our national partner. The National Alliance to End Homelessness has also made a detailed thing, and I'll put that in the chat as well. They do have a lot of research analysis that they've done on this proposed bill. And kind of more details about the process, what it would look like, how it could be quickly pushed through the process, summary of the items that would be affected. So you could see that that's what I just said, is eliminate funding for these activities. And then move those to a formula based and not like the CoC program, a competition, which is placing thousands of currently operating programs at risk. So that is the information. There are other aspects of this bill. Please feel free to read it, that affect Medicaid. And so you'll see here, they are trying to engage anybody who is interested in advocacy and sharing their stories on a nationwide item. So they do have ways to take action, show your concerns, all of that. So we wanted to ensure that we pass along that information so that everybody feels the opportunity to advocate if they would like to. There's lots of take actions. There's lots of forms that they have, signed documents. So anything that you're concerned about, feel free. And now you guys all have this link. There are other parts of this too that are important to look at, but for the purpose of this meeting, I wanted to share specifically the CoC concerns.
Shanae, do we have any indications at all if they proceeded with this as is, what that implementation would look like and how that would, like, does that do away with lead agencies? I don't know. It's hard to imagine how that would even look. Is it just them funneling the money through an additional agency, or how?
Yeah, so a lot of our national partners are doing webinars. There is one tomorrow that they're going to dive deep, like with that exact question, what does this look like? But yes, it would eliminate, especially in the last skinny budget, it was very clear that it would eliminate CoC planning funds, which is the amount of money that we as the CoC lead receive to facilitate, to staff all of these meetings, all of our activities, the application to apply for funds. Everything we do is funded by the CoC planning grant. So essentially, yes, then you would have no entity that would be able to do this work because there would be no funding to support it.
Shanae, this is Jeanette from NECAP. Someplace in this document, it also describes their proposal for transferring several housing programs to the state.
Yes.
I might be getting that because they also want to transfer the HCV program, which housing authorities administer,
Yes.
to the state as a block grant.
Yes. So I believe that is right above or something. I believe it's right above the rental assistance one. So here's administration, here's lead.
What do
So
they
here's
call
fair
it?
housing.
No, they call it this.
Yeah, I believe so. What?
I just briefly looked at it the other day.
Yeah, I know. I think I know exactly what you're talking about. If anybody knows the page that's on, feel free to throw that in the chat. But I think I know what you're talking about. Yes. I'm skimming through this very quickly.
Shanae, don't beat yourself up. There's what, 1,200 pages there?
Yeah, don't worry. Yeah, I was just, oh, yeah, the state rental
Right here.
assistance program is
Yeah.
what they were. So I guess though, if they combine,
Yeah, so you can see that they're combining, this is the state rental assistance, which they're creating, but it doesn't request funding for the housing for the elderly. If you read it closely, a lot of these also talk about how, like in the budget, it's spend down this money. So like it looks like they're giving them money, but it's saying spend down the current money you have. So it's like projecting the current money that's already been awarded, and it's not awarding new funds after that. So that's really their key places on here to make sure you're looking at that as well.
yeah, thank you.
Yeah, so here's this does not request funding for housing for persons with disabilities. So a lot of these things, definitely pay attention to this as well, because it shows exactly what is being left out and is not going to be funded. So even if it looks like there is going to be an increase, it might not be an increase with what is currently being awarded.
Well, and TEBRA is also eliminated. So, and they sometimes refer to the HCV program as TEBRA, but then the TEBRA is separate under the home program, which they are proposing to eliminate.
Yeah.
So even if we can move people into housing, the options are going to become very restricted.
Yes. Yes, so definitely read through it, advocate, and then on that note, in the I'm just keep going, Beth. So we did send out a survey for anybody that's being affected. We are using this survey to advocate with our legislators, to share with media. So I did, if you received the email this morning about this meeting, it was also included on there. So let me pull it up. Give me one second. It is called the KSBOS CoC Federal Impact Report. I will not go into detail about it with this meeting, but it is basically all of the people who have submitted that they are being impacted due to these changes in the federal and programs and fundings. So you can see that was our purpose and our goal. Here's a disclaimer just for anybody who's sharing these numbers to ensure that that information is correct, what it covers. You'll see that most of the people who submitted are the CoC members, so they're people in this room right now. 65% had HUD funding. These are the coverage areas. One disclaimer I want to write, like even if there's only one entity or one response, sometimes there's only one housing provider in that area. So please don't take that as like, oh, there's not that many movements. It could be that that's the only provider. You can see 98% of agencies confirmed that they're working with those who are experiencing homelessness. And then now we're going to dive deep into what is going on with agencies. So this one is going over unexpected situations, what's happening. We talked about all areas, staff, clients, full program closures, reduction in housing navigation or housing location services. Then we wanted details, what's actually happening out there. So you can see delays in contract execution, delays in reimbursements, all of those things. You can see how many responses confirmed that they're experiencing that. This one's talking about staffing, what's happening with our staff and our member agencies. And then this one is how much funding is being affected. So you can see that an agency reported that their funding of almost $1 million was affected, and then $500,000, 400,000, 400,000. These are all different responses. And then you can see that some percentage of budgets got cut. All those concerns, we wanted to ask them about the number of staff that were affected. So you can see 18, 6, 5, 5. This just for is how many people said the same thing. So two people said 5, so that's actually 10, right? So just how to read that piece. Then this one is overall organizational stability. As you can see, only about 15% of the people who responded said they're very stable, and everybody else is either stable or cautious or has concern, or they've already determined that their organization is unstable due to these changes. We talked about barriers or disruptions to for clients. So our clients experiencing barriers, you'll see more than 50% said yes, clients are now being affected. And then we asked for details on how clients are being affected. So you can see this was what everybody said about their clients and stories about what's going on. You can see we got pages of that. We asked about what type of populations are being affected. So you can see a huge amount of families. You can see over and over and over that agencies are concerned about families are big ones, survivors are big ones, youth, immigrants, refugees, or domestic violence. You can see that lots of people are just saying the same thing. So a lot of our vulnerable populations are being affected. Here we talked about future in the next 6 months. Where do you think you might be? You can see a lot of these are already yeses, that they already see that their programs are going to be shut down. They've already had to reduce, or they plan on reducing. They're actively planning on winding down or closing programs. There's possible concerns here. There's unsure concerns here. And then a good amount are no, which is awesome that they don't see programs in the future being at risk. Then this here is a key thing. We wanted to know what their top 3 needs are as organizations. So this is what you guys told us. So now we're sharing it back with you so that we can help lead. So KSHC, Kayla's work, our advocacy, our bills, talking to media. We're using a lot of these key things to guide those conversations, and we encourage that you guys do as well. So read through this report. Feel free to use it to look at So here's all the top needs that everybody says that they need. Then this one is, how can the CoC, that's everybody here, help the agencies? So us at KSCC, we're looking through this to see how we can help, if there's anything extra we need to do. And then, so you can see we have a couple pages of that. This last thing is stories. We encourage anybody to share stories about what's going on in their organization, so that we can guide media and advocacy work. And so that is all. So that is available. I will also have it up on our website under our KSBOS CoC page soon, but you should also have it available in your reminder email from this morning. It is listed there. So I do want to thank everybody who has submitted that. We are encouraging, if you have any new impacts that happening, to keep filling that out. We are keeping it open because we want to know what is continuously changing. And this is going to be a big survey if this budget gets pushed, and that's a really big thing that we're going to need to know of how it's impacting our agencies, so that we can keep advocating. So please feel free to use this report to advocate on your own, talk to media, talk to whoever you want using this information. Any questions about that before I move on to maybe something more exciting? Okay, so I'll keep going. Okay, so the next thing is HUD did release a CoC builds NOFO. So this NOFO was meant to provide capital costs for agencies to build, buy, or rehab units to put them into our balance estate for permanent supportive housing units. So for households that are experiencing homelessness with disabilities. That letter of intent is available and out. We completed a training on it on Friday, and we can only choose one application. So the process on that is we've decided to do a scored matching HUD score, so that the highest scored application can move on to HUD. HUD does anticipate that they will be only choosing 8 awards nationally. So that is super important. We can propose a project that is up to $6 million. And the most recent NOFO, the normal NOFO, Megan?
Yes, sorry.
Yeah, so the last one that went out last year was a 2-year grant, yes. So they were operating last year and this year, right, Christy? Yeah, okay. We don't know what the future is going to look like yet. They haven't provided any details in regards to if it's going to be a 1-year or a 2-year again next year, but we're keeping our ear to the ground so that we can keep a hold of that. So for the CoC build NOFO though, we can choose one application up to $6 million to either build permanent supportive housing units, acquire permanent supportive housing units, or rehab permanent supportive housing units. If you would like more details on that, I will put the link for our webpage in the chat. I have already posted the training that we had on Friday. It is not required to attend that training, so just because you missed it doesn't mean you can't apply. That's totally, it's not required. It's highly encouraged though, because it's going to walk you through the letter of intent, how to fill it out. So please do that if you're interested in applying. So that link to our website, you'll see all of our details, policies and procedures, e-snaps, how to have a profile, and all the documents directly from HUD. At the bottom of the page, you can see our timeline. So the letter of intent will be due next week at noon. Anybody will have 24 hours to appeal the decision. The letter of intent is built to score automatically, so you'll know your own score before you push submit. It is built to tell you how much you scored. So please feel free to check that. I will also be publishing a technical assistance meetings that you can schedule straight with me if you have any questions. And then on that same day, on the 12th, we should have the decision of who scored the highest. And then after that, until it's due, which is June 24th, I will be providing technical assistance for that final applicant to submit their application through eSnaps. So that we can get that done, and the final date to HUD will be the 26th. So if you haven't, there's the training right there. And then feel free to reach out to me if you have any questions. I will put my email in the chat. Any questions on the CoC NOFO builds? All right. Okay, and then so the next thing I have on our agenda is going over the NOFA score debrief. And so give me 1 second and I will bring that up. This will be pretty quickly. All right. So HUD released the scores of how we scored as a CoC on our application. So this is for fiscal year 2024. And so I wanted to debrief with everybody to let you know what's going on. Before we start though, I know we have some new people who may not know anything I'm talking about. So I kind of just wanted to debrief. Let's start with the homeless response system. So HUD defines the homeless response system as a coordinated community-wide effort to prevent and end homelessness. So this includes everything that could potentially end or prevent homelessness. So emergency shelters, outreach, permanent housing, prevention, diversion, coordinated entry, HMIS, mainstream systems like healthcare, behavioral health, education, criminal justice. Anybody who interacts with an individual who's experiencing homelessness can contribute to the homeless response system, right? It is our response to homelessness is essentially what that means. So the CoC, so this membership, everybody here who is on this call serves as a backbone, and it depends on our coordination and working together and building partnerships to deliver services, reduce barriers, and track outcomes for those who are experiencing homelessness. HUD does like equitable, data-informed, and rooted in housing first principles for the NOFA that I'm talking about. So our CoC, just to sum up, our CoC is not a single agency or a funding stream, it's a system. And that is what we are here today to do, is be a system. It's the way we coordinate across programs, share resources, reach underserved population is central to how HUD evaluates our effectiveness and allocates funding, CoC funding, continuum of care funding. Okay, so why everyone in this Zoom room matters. So the strength of our homeless response system depends on how all partners coordinate, not just those with HUD funding or HMIS access. So please know that even if you don't have HMIS, even if you don't have any type of HUD funding, you're part of this homeless response system, and what you do matters. So our key partnerships that HUD wants us to look at is with healthcare providers, behavioral health and substance abuse programs, public housing authorities, schools, local governments, workforce agencies, the criminal justice system, child welfare services, faith-based organization, grassroots efforts, and people with lived experience. So that is why our CoC is open for anybody to join, because they're part of this response system. So our system outcomes are shaped by the entire system, including organizations that don't receive CoC funding, participate in HMIS, or engage in CoC planning. So even if you don't have those, you're here now to contribute to the way we respond to homelessness, and that is what HUD scores us on. And then allocates funding. Okay, so how HUD evaluates our system. Every year, they send out something called NOFO, which is the Notice of Funding Opportunity. So it is called the CoC NOFA because it funds any CoC member within our area with funding. So in that NOFA, they set national priorities and defines how applications will be scored. Our CoC application, so we answer all the questions they give us, we bring it all together, we take all of project applications, so agencies that want to be funded by the CoC, which could be permanent housing, rapid rehousing, all types of things. We put it all into one application and we send it to HUD. HUD reviewed that application and has now sent us this feedback that I'll be presenting on here shortly. So to understand where we succeeded or missed points, we have to compare our scores to the original intent of the NOFA. So you'll see that this morning in that reminder email, I sent out both wait, no, I didn't, sorry. But I'll go over it during this meeting right now. So the debrief tells us how HUD interpreted our work, but the NOFA tells us what they were looking for in the first place. So we connect the two, we can strengthen our future applications and improve how we serve people across our system. Okay, so they gave us our total score. So we received 148.5 points out of 200 points. In national context, the highest CoC score that was achieved by anybody was 185.5. The medium score of all the CoCs was 151.5. The lowest CoC that got a score was 54.5. So as you can see, we are slightly below the medium score across the board. It is a snapshot of what we submitted, or the work we were doing, and a starting point for focused improvements. I wanted to go over what we did really well in, that we got all of the points for. So the first one is survivor protections, including safety and planning, confidentiality, and foul compliance. We got 5 out of 5 points. So I do want to state that this work isn't just the work that KSHC did, Kansas Statewide Homeless Coalition. It's the work that you guys told us you do. So when we reached out to you, when we contacted our victim service providers, we were like, what are your processes? We summed up that, we put it in the application, and we sent it off. So this score closely resembles the work that we are doing with our partner victim service providers, the work we're all doing, our policies and procedures and our written standards, literally everything. We summed it all up and put it in this, and we got full points. So I definitely, want to give a clap to our victim service providers who really assisted with this work, who are on this call together. We appreciate you guys. It is shown, and HUD sees it by giving us full points. So if we keep going, you'll see that we did this for the rest of them as well. Our collaboration with public health agencies, 5 out of 5 points. That was connected to partnerships that you guys have established. So if you guys had MOUs with health agencies, it contributed to this score, and it will allow us to get more money. So definitely feel free to keep working on healthcare partnerships, because as you can see, it does contribute to our score. Coordinated entry system, 6 out of 6 points. So that's pulling it all together, transparency around rights and remedies. So our process to our rank and review of the CoC projects who are interested in the funding, they looked at that. We got 17 out of 18 points. We're pretty excited about that. And then these following 3 things were directly from data. So the data that was in HMIS that we uploaded to HUD, this is where we got those points at. So we showed a reduction in the length of homelessness. We showed a increase in exits to permanent housing and retention. We had a reduction of returns to homelessness after 12 months. We all got points out of that. And leveraging healthcare resources and partnerships, we got 7 out of 7 points. So this reflects the core strengths that we have been able to show, the work that you guys have been able to provide. So we're pretty excited, and thank you all for that work to show all of these things. Then a moment. Okay. All right, now where we lost points. So this is important because we want to emphasize the areas that we need to work on moving forward so we can be ready for next year's CoC NOFA, and we can improve and bring in more money. The higher the score, the more money it is, essentially, guys. So this definitely contributes to the items that we are working with. The first one is street outreach to people least likely to seek services. We definitely think with how all of you guys are working so hard with Built for Zero, improving the outreach policies under Built for Zero, that we anticipate getting a better score in this area. A rapid rehousing bed coverage in HMIS. We need to improve the rapid rehousing beds that are in our system, that is reflective. So that is why we want to bring on non-HUD funded agencies into our HMIS system so that we can have their beds. We can show HUD that we have full data on everybody who's serving those homelessness. So that is still open. If you are interested in, if you have beds and you'd like to be in our data system, please feel free to reach out to me and I can walk you through that. Next one is involving individuals with lived experience of homelessness in service delivery and decision making. So the key items that Kayla is working on, the lived experience advisory board, bringing on new members that have lived experience, making them key parts of our decision making. It did show that we did get some points out of that, but we didn't get full points. So we do definitely want to engage more. I'll also be sending out a lot of surveys in regards to, you know, do you have lived experience as a staff member, maybe, so that we can fully provide the picture of how we are involving those with lived experience. The fact that we have an open membership for people with lived experience, they can just join right on. They can, you know, be in this meeting. They can influence our discussions. They can vote. So those things like that. The next one is, again, HMIS bed coverage. So we need to bring more people into HMIS. We had an increase of first-time homelessness, unfortunately, in our data. We had an increase in the length of time homeless, not an increase, sorry, the narrative piece is where we lost points at. So the last one with our strength, data-wise, we did great. But the reason why we need to improve our narrative section is we need to articulate to HUD the exact work we're doing that supports our data. So that is something that I'll be focused on. So for instance, I might reach out and tell people, hey, it looks like our data shows that we reduce length of time homelessness. I might ask all of you guys, what did you guys do to reduce length of homelessness? I grab all your responses and I put it in the application. I submit it to HUD, right? So that's going to help us improve the narrative sections. So we did great in the data, but we need to improve the narrative. So involving you guys, attending these meetings, sharing your perspective is huge for this score. Because as you can see, we did not get points for our narrative. So that is key. Next one, data, we increased our returns to homelessness within 6 months. So the last one, we decreased it by 12 months period, but there was an increase in the 6 months period. So that's something to highlight. We did not have an increase in income from employment. So that's why those workforce partnerships are super important, because HUD looks at that. We did not have an increase in non-cash benefits. So again, partnerships, super important, supportive services for our agencies, and then leveraging housing resources was something we also lost points for. We had points for the partnerships in healthcare, but not housing. So a key to that is, for instance, you could say, I want to apply for CoC fund. So let's do the CoC builds thing that is going on right now. You can say, I want to build 10 permanent supportive housing units. We would need to show that that agency is going to find a partnership or find anything to maybe partner with 5 different units, right? So it's pooling housing resources from multiple entities or donations or in-kind or match that would support housing with housing, right? So we do that, but I do also think we need to provide a better narrative, reaching out to all of our partners. How many units does other sources support you and stuff like that? So I think that's also a narrative thing. So these scores don't mean we aren't doing the important work. They often reflect areas where our efforts weren't fully documented, like I was saying, or we can strengthen coordination and data collection. So by understanding where these points were missed, we can better tell the story of our system and improve. All right. This is my first attempt to say, hey, all the areas that we need to improve on. I encourage you to do a survey, and I'll be sending this out multiple times throughout this year so that we can focus on those areas that we need to improve, that HUD specifically told us we need to improve, so that I can get your guys' feedback. So it's just a few questions. It's just those areas that we need to improve. And so feel free to fill that out, and I will also send this out separately. Any questions about our debrief? I do see some chats going on. Let me review them really quickly. Awesome. Thank you, Alicia. All about strengthening partnerships. Awesome. Yes. Another key thing that I'm hoping to do is when I reach out to all of you asking about like your logo and stuff like that, I'll also be asking if you are willing to partner with other agencies. A key thing we want to do is bring you guys together. You might not have heard of each other, right? But part of my coordination work is to bring the agencies together and build those partnerships and help you guys build those partnerships together. So that will be something that I'll be doing, is highlighting all the agencies in our CoCs, bringing some partnerships together, onboarding new agencies into our CoC membership. So those are definitely something that I will be working on. Okay, and then I'll just keep going just a little bit more, Beth. Old business, just reminders. I'm not going to read this. We do still have some seats available. So feel free to reach out to if there's any seats, any provider here that can fill these seats here. Here's a nomination form. Kayla, how are we with the lived experience advisory board?
Yep, we voted and she's been added. The only thing we're missing is for the youth advisory board, which we're still we had some people age out, so we're working on building that back up.
Perfect. Awesome. And then we are looking for memberships from Performance and Compliance. For non-CoC funded entity, the Performance and Compliance Committee is the entity that creates the policies to create our CoC NOFO, create our responses, our application, the rank and review panel. So how we do how we do and submit those applications that I just talked about, that is part of the Performance and Compliance Committee. So that is open. Feel free to email me. And that is all I have, Beth.
That all. Just teasing. Thank you, Shanae, very much. Any questions for Shanae before we move on? All right, hearing none, we will move on to our presentation from Marcy Smith with Refugee and Barriers to Housing.
I will not take 45 minutes. In fact, I will probably try to get done a little quicker than I'd planned because I do have another meeting at noon. And so I'm a little worried about getting to that. So, but I will get started. So I am Marcy Smith. I'm with Catholic Charities of Southwest Kansas, and I handle the refugee resettlement program as well as the housing program. So Kayla asked me to present on this. I think now in the current climate we have, we're seeing a lot more uncertainty in our housing with our migrant population. So I'm going to talk about the populations we have in Southwest Kansas to start, just to give a little bit of background on what we do have in our diversity. And can you guys see my screen? Because it just went blank.
It went blank for us too.
Don't know why it did that. It just went completely black. It's thinking maybe. I don't know what it's doing. Okay, that was weird. We'll try this again. So I'm going to talk about the populations that we have in Southwest Kansas, just to kind of give a little bit of background of the different populations we work with on a regular basis. Talk about some of the factors that do cause their instability in housing, the risk to their success and their being able to meet the outcomes of the programs, some best practices and some personal stories. I do want to have a caveat that I am not at all an expert. This is just based on what I have seen and what we have worked with in our housing program in general. So Southwest Kansas is pretty diverse. We have a lot of different populations. So I wanted to go through a little bit as to what we have taken in. This would be at the start of our FY24 year, which was October 1st of 24 through March 31st of 25. With the new administration changes, they did shut down refugee resettlement on January 24th. So anybody that has arrived between January 24th and March 31st have been secondary migrants. Those numbers have been very small. So this is, I'll just let you guys look at this. I don't think I need to read it to you, but these are the different countries we received either refugees from. So this is not people that have come to the country through the border undocumented. This is people that have been vetted through the refugee program and came as refugees. So as you'll see, our Cuban Haitian number is very large. We had 1,800 Cuban and Haitians come into Southwest Kansas during this time. This was part of the Biden administration's policy to allow humanitarian parole. So there's been a lot of this in the news. And this is the population that's probably most at risk right now because they are losing status through the new administration's changes. So we work with the Office of Refugee Resettlement. So I just wanted to kind of do a brief understanding of what that means. So there's certain eligibility requirements through the Office of Refugee Resettlement. They either have to be a refugee, asylee, Cuban Haitian entrant, Amerasian, special immigrant visas, human trafficking, foreign nationals, or certain humanitarian parole for Afghan and Ukraine was a special thing that was added during the Afghan-Ukraine crisis. So they have to meet this criteria for them to be eligible to receive services through the Office of Refugee Resettlement. So I thought it was important also because I know you guys don't all work with refugees, and so just knowing the difference in what a refugee is compared to other migrants. So a refugee is someone who has been forced to leave their country to escape war, persecution, or natural disaster. These individuals cannot return to their home country due to well-founded fear of persecution, can be based on race, religion, nationality, political opinion, or membership. In a particular social group. I didn't finish my reading, sorry. A lot of times these people are vetted for years and years. There's a really strong vetting process with the refugees. They're probably the most vetted population that comes into the United States. They often spend many years in a refugee camp before they're allowed to come to the U.S. The Cuban Haitian entrance, this has been a classification in the U.S. since I think the 60s. At least I know the Cuban Adjustment Act was from like 68. So this is not an immigration status though, it is a refugee classification. So they are eligible for Office of Refugee Resettlement benefits, but that does not mean they're eligible for immigration status. So that's something that's hard to reconcile and doesn't always make sense. So as long as the Cuban Haitian comes in on parole or some other status like that, and they have no removal order from the United States, then they are eligible for ORR services, but that does not mean they're actually eligible to remain in the US legally. I know that's very confusing. So, and then of course, I think everybody knows what the undocumented immigrant is, but that would be a foreign-born person who resides in the country without any authorization. And they often have a lot of significant challenges, including limited access to healthcare, education, legal employment. They also live under that constant threat of deportation. So some of the factors that we see that cause instability within the migrant population is the same as it is with a lot of housing, regular people that we deal with and that are experiencing housing crisis. So trauma, mental health needs, I think the trauma is just a little bit different when you're dealing with refugees and immigrants. A lot of times they have trauma about leaving their home. They may have been involved in war or persecution, violence, extreme poverty before they ever left their country. So they have that, what they call pre-arrival trauma. And then the journey itself can cause additional trauma. So they may have dangerous travel conditions, exploitation, or separation from family members. I think the separation from family members is a really huge one we see, because a lot of times they're in the refugee camps for so long that they may have grown up there, got married, and had children of their own. Yet when their family comes up to travel and go to the United States or another country, they have to leave behind that wife and child or that husband because they are not on the same family unit and were not vetted in the same family unit, if that makes sense. So that is one of the really big ones we see. There's also then a lot of post-migration trauma, because when they arrive in their new country, a lot of times there's discrimination, there's can be legal uncertainties. They have difficulty accessing basic services because they don't know how to do that on their own. And just the changes in what the U.S. brings, there's a lot of things there. So with mental health treatment, it's also very hard for them to get mental health treatment because of language barriers and cultural differences. If you can imagine trying to explain what's going on with you and how you're feeling through a translator. So everything you say then goes to the translator, then goes to your therapist. So it's just very hard to get good mental health care when they get here because of the different languages. A lot of times people arrive with a lot of medical needs. Sometimes they're very serious medical needs. So then this affects their economic status a lot of times, because when you don't speak the language, the types of jobs you get, or if you don't have any background, the types of job you get is going to be physical labor. But when you have all these medical needs, then physical labor is very hard to get a job in that way. Like the plants hire a lot of people that don't speak English. But if you have problems with your legs, or you maybe have heart disease or things like that, it's really hard to get those jobs. So then that affects their economic status. The political climate right now is really affecting people, I think. Family reunification has completely ended. So people that have come and have been waiting for their family to reunify, that is no longer available to them. So this then affects their mental health. there is still a lot of discrimination. We're seeing a lot of work authorizations being revoked for people, certain classes of people, I guess, like we're seeing the Haitians be targeted a lot and the Cubans right now. So that is affecting also their economic status because they're losing their ability to work. We're really concerned. So just Friday, a lot of this happened Friday where a lot of people lost their status on Friday, a lot of Cubans and Haitians. We know that just one of our plants in Southwest Kansas laid off 150 people on Monday. So this is going to be an extreme thing for Southwest Kansas because people are going to have food insecurity. They're going to have housing insecurity and just the fear that's through the communities right now. So we know that we've already started seeing people asking for rent help and asking, so it's just going to trickle down, I think, through our communities. And then just the deportation threat in itself, I think, causes a lot of mental health, a lot of fear. Immigration statuses are really up in the air right now. There's a lot of people that have applied for legal immigration statuses, but we did see last week, we had a gentleman that was one of the Cubans. He went to report to his ICE appointment. He does have a pending asylum application. They still detained and deported him. So we don't know what is going to happen even with the ongoing applications that are out there. So there's just a lot of instability and they all tend to kind of spiderweb back to each other, in the whole circle of things. So. And then this, I think, was important to talk about because I think there is a risk to us as providers when we provide services to this population, because it is a lot harder for them to achieve stability. It's a lot harder for them to meet the outcomes because they maybe can't work or they are navigating the immigration system. So it's just hard to set those goals for self-sufficiency and be able to reach them. They're also a much more nomadic group of people. Refugees are often, it'll be like Friday, 5 o'clock, I'm moving to Wichita tomorrow, and this is what happens a lot of times. So there's not a lot of planning. They just think they found something better. They think they know somebody that can help them. And so they do move a lot, which again, then affects outcomes. The language barriers can be difficult with the case managers and being able to build rapport or to provide the services in their language. It does take more to have the translators and the language line. It costs more. So that's also difficult. And then this affects our annual outcomes, which then affects our scoring, as Shanae was just talking about, because we're not able to meet those outcomes as efficiently. And again, I'm not an expert on this, but this is what I feel like helps the most when we're dealing with our refugee and immigrant populations is having partnerships within your community, a lot of times having church groups or other groups that are willing to sponsor or mentor a family. They're usually very high need families. So having somebody that can just even check in on them, maybe help take them to appointments if necessary, help get them to the places they need to be, really helps the case manager to be able to have a successful outcome. So, what else do I have here? And just learning to navigate the US is it's a big issue. And though they get that when they come in to an extent, it's something that has to be told over and over and over again. And with the closing of a lot of the refugee programs, this intense case management, intense cultural orientation is not available anymore for most of the refugees. So when you're working with a refugee family, it's really important that they may not know how to properly use their thermostat. They may not know how to properly use their appliances. It's really some of those very basic things. We find a lot of times they're coming from really warm climates, and so they will put their thermostat on 85. Well, as you know, then we have a $300 gas bill. So it's just things like that that you really have to, get into the really basic things of running a household so that they are running their household efficiently and able to continue, paying for things as necessary. They also often don't know how to, pay bills like as far as, where do they go to pay their electric? How does that work? Those kind of things have to be taught to them over and over again until they understand and can move forward in doing that stuff on their own. So case management is a lot more intense for people that may come from another country. I think training staff on cultural competency and cultural humility is very important. There is a little bit of difference between the two. Cultural competency refers to understanding different cultures and being able to react or interact with cultures. Cultural humility is more of a lifelong process of self-reflection and self-critique, recognizing that there's power imbalances and being open to learning from different cultures and understanding their cultures. It's more of an individual thing, kind of checking your biases out the door. And then working with landlords. What I found in working with landlords when you're dealing with refugee families is really taking some time to talk with the landlords about where they came from, how their country was, what they may know and not know, why they came here. I think really the landlords that I've been successful in getting to rent to refugees usually feel like they're actually helping them to get something they didn't have in their country. They're like, oh, they just are probably so excited to have a house when they lived in a tent, or they're so, and so I think you just have to really be honest with the landlords, explaining, what they know, where they came from, and what you're planning on doing with them. I think that is probably the most important. Like, I'm going to meet with them every week, or we're going to have them in these classes, or, so that the landlord knows they have that support, is what I've had the best luck with in making sure landlords understand. A lot of times they are larger families as well, so that becomes an issue with landlords, just being able to put that many people in a house sometimes, and what that means for the wear and tear on the house. So that's also something you really have to work with landlords. I did that all pretty quickly. I do have some stories I wanted to share, but I think I will do questions first because I know that we are having a long day. So does anybody have questions? Take that as no. I just spouted right through that. So I wanted to talk to about a few stories that we've had in our housing program in Southwest Kansas, just so that you know what some of the barriers were for those people. So the first one was a refugee that came from Burma. He's Rohingyan. He arrived in 2019. He had had a stroke right before coming to the U.S. Because he could not afford to pay for his treatment, he received no treatment within the refugee camp, and that's very common. We see that a lot. So he had lost the use of his left arm. We tried to get him into medical care and things, but it was too late. With a stroke, you really have to do it almost immediately, and he had lost that time frame. So we did try several different ways to get him employed. He worked at Tyson for a short period, could not do that. He worked in a cafeteria for a short period, could not handle pushing the trash cans, and that was what got him there. He was able to, oops, I even changed my screen, sorry, but he was able to work in a grocery store for about a year, sacking groceries. But he was living with a friend. And when you can no longer pay your bills and you're not able to do that, the friend did kick him out of his house. We were able to house him through ESG homeless prevention funds. During the time he was on ESG, we assisted him with applying for a HUD voucher, and we also assisted him with applying for disability. He does currently receive both HUD and disability, so he is stable right now, but it's short-lived because SSI rules require that you become a citizen within 7 years of arriving in the U.S., or you can no longer qualify for Social Security. So he has to become a citizen by October of 2025. So we are working with him still. He has applied for citizenship twice and been denied because of problems with his medical. So there's just a lot to navigate in the immigration system. Because of his stroke, he cannot learn English. He knows very, very little. So he will not be able to test in English for his citizenship, and that has been the issue because we have to get proof through medical that he cannot do that and why he cannot do that so that he is able to move forward with his citizenship. And then we have a girl currently that we have just housed recently. So she left an abusive relationship in Guatemala. So she has no status. She is undocumented. She was pregnant when she arrived. We first came in contact with her at Stepping Stone Shelter in Liberal. She had a brand new, like 3-day-old baby in the shelter. So she is currently in our rapid rehousing program, but she really is at a loss for stability. We're not sure what will, what we'll be able to do to make her sustainable because she does not qualify to work. She does not qualify for any immigration status. So that's one of those that you kind of take on that risk when you house them. We had a gal from Dodge City. This was a Dodge City one. Her husband was deported, and this was several years ago, but we also still work with her. Her husband was deported. She had 7 children. Her husband was the primary breadwinner of the family. We did house her in our housing program for 2 years. She has been able to maintain her housing, but she still needs a lot of help. Because she also is undocumented, so she does work under the table some, but it's just not enough to sustain her family. She uses local soup kitchens daily to feed her family, as well as food boxes. She uses the free school lunch programs in the summer. And her son recently quit school this year so that he could work and provide for the family. He's 17. So this again is just one of those, even though she is sustaining housing right now, she really does not have what she needs to move forward and really be self-sufficient. And then the last story I had was a gentleman that we met through we had a traffic victims case in Garden City. So he was on our traffic victims assistance program. Because of that, he was being housed at that time with the trafficker was providing housing. So he lost his housing and was homeless. There was 3 of them in the household that he was in that all became homeless. 2 of them had family in other states and were able to kind of move on with that. He kind of lived with friends here and there. He was finally put on our housing program about a year after his traffic victims case. And we were able to find out some stuff, and these are just things you have to ask and have to know, I guess, that he had a work authorization document through temporary protective status and had lost it. Well, when you're dealing with immigration, everything has a fee. So he had lost his document. He was homeless, couldn't work because he didn't have his document and was unable to get that immigration status renewed. So part of immigration, when you want to have a waiver of your fees, you have to have a food stamp letter. So this is where the circle gets messy because he could not get food stamps because he didn't have his documents, and he couldn't get a waiver for immigration because he didn't have the food stamps. We have sent in a lot of documentation showing that he was homeless, that he's on our homeless program. It's all still pending. We're hoping that they will accept that instead of the food stamp letter to show that he cannot afford the $1,100 fee to renew his his TPS. So he currently cannot work, but he is being housed. He does use the food banks and stuff as well. And we're just kind of waiting to see if we can get that TPS document replaced so that he will be able to work and continue on to be more self-sufficient. So as you see, there's just a lot of different needs for the immigrant population, and they're all different. And so you do have to kind of understand where they come from and what the immigration processes are in order to properly help them. But it is definitely a lot more case management and a lot more one-on-one individualized planning that needs to be done when you're working with this population. So that's all I had. If nobody has questions, did I go too fast, Kayla?
No, I think you did great. And thank you so much, Marcy. This was very, very informational and helpful. And I appreciate all the work that you guys are doing. Does anybody have any questions? Or I did put Marcy's email in the chat if anybody wants to connect with her with any questions outside of this meeting. And thanks
And
again,
we would be
Marcy.
glad to help with immigration questions too. We have legal immigration staff on with Catholic Charities, and I would not give you that advice, but I would definitely connect you with them to get that advice. So,
thank you, Marcy.
thank you.
Thank you guys for hanging in there, and I know this has been a little bit longer meeting, but we really appreciate the information that Marcy had to share, and appreciate you being here for the meeting. Anything else before we adjourn? All right,
is
stay strong. And, oh,
Sorry, this is Carol Lee from Bloomhouse. I just wanted to say this has been a really kind of disheartening and frustrating meeting, but I really appreciate the camaraderie of everyone else who is stuck in this together.
absolutely. Absolutely. That's what I was just about to say is stay strong and keep up the good fight. We're all working for a good cause, and there are definitely some disheartening things happening and disheartening information coming out, but I think we just have to keep the focus on the work that we do and the people that we serve, and continue to remind everybody else about the work that we do and the people we serve. And certainly we'll continue to share information together as things play out, and as we have information, and just have to stick in there and trust that one way or another that we're going to figure this out together. Anything else before we adjourn?
And Beth, I was just thinking, is there a way to use the fact that we're in Kansas to our advantage? Like, we're not coastal liberals, so to speak. You know, we're not, we're actually people that most of us, you know, there's a lot of alignment with what we could do and our state could do. So just a way to think about it, that there might be allies that we don't think of.
Sure, and I think, I mean, absolutely continuing to be in contact with our local representatives as much as possible, and certainly if anybody sees opportunities to increase our voice, please share them with Shanae, share them with Christy. I think that's a good point, Megan, is that there has to be some middle ground here. Not everything is, you know, not everything comes down to far left and far right, and we are in a fairly conservative state, and we're doing important work, and it's important that everybody continue to know that and share that and look for opportunities. Anybody else have any input or anything to share? Then we would entertain a motion to adjourn.
This is Chad. I move that we adjourn.
Thank you, Chad.
This is Claudette. I second.
Thank you, Claudette. All in favor, say aye and go have a great week and great week and go make a difference.
Aye.
Aye.
Thank you all.